Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in the treatment of hyperlipidemias, HMG-CoA inhibitors, cholesterol absorption inhibitors, bile acid sequestrants is done. Then the next drugs are PCSK9 inhibitors. These PCSK9 inhibitors are, we have evolocumab and alirocumab. Evolocumab and alirocumab, these will, as the name says, they will inhibit the PCSK9, and thus they decrease the PCSK9 activity. They will increase the LDL receptors. So thus the uses of this PCSK9 inhibitors are, it is used in conditions where there is elevated LDL cholesterol levels, and the side effects of PCSK9 inhibitors are, it can cause, because it is a, because these are monoclonal antibodies, they should be given by parenteral route. So these will have injection site reactions are more common in PCSK9 inhibitors.
thank you and thank you for watching.